President Dr. Lovell, thank you so much for taking the time. I know how busy you are, so thank you so much for that. And that would probably perfectly relate to my first question. You have been president for 2 months now. How has been your experience so far?
Almost 2 months, having a great time. What a fabulous university we have up here on the hilltop. It's been so busy, and I wish I had more time in the day.
Pretty sure about that, and especially during those times. Yeah, COVID, we kind of thought like a year ago, yeah, it's gonna be over, but it's not. And what you guys have started was a $100 incentive program for students, and my first question would be, who had the idea?
Well, first, yes, we all thought it was over. We were celebrating, we were returning back to normal, and we all had to kind of grieve when the realization hit that those numbers were going back up. And so we met as a cabinet, and we have a safety committee, and we talked about what can we do to help keep SWOSU open. And of course, we don't have all the tools that we'd like to, masks or vaccinations that might help us reduce serious illness and hospitalizations and the disruption that so many people in our society getting sick causes. So other universities in the nation, but particularly in Oklahoma, like OSU and OU, started doing incentive programs. And so we looked into the legalities of it and what we could spend monies on. So the monies that we're spending for our incentive program are monies that we already have to spend for COVID-related mitigation. And we'd rather it go to our students who can use it for what they think that they would like to use it for. So it's $100 for each student and $125 for each employee. So all of our SWOSU community is included in it. And the $125 for the employees is because they have to pay taxes on it, where the students don't have to pay taxes on it.
I was wondering.
And of course, we don't have nearly as much money as OU or OSU. The OU were offering incentives as OSU is, but also they would offer drawings for iPads and lots of electronics, a lot of things. And so we say that if you as a student, for instance, upload your vaccination card, or you upload a religious objection, or you upload, your doctor says you shouldn't be vaccinated, then you all get put in a drawing for 4 $5,000 awards. Now you can use that as pay off for next semester, or you can do what you want with the money.
That's actually, thank you so much for telling me that, because I had, like, from the first time I actually saw that those religious exemptions and medical exemptions, I never saw that they were ever mentioned. And then we even had a comment on our Instagram page saying it's discrimination, yeah, for all the people who can't get vaccinated, or for religious reasons. So
yes, we modeled after some of the bigger universities, and they put it in their terms and conditions, and then we just spread the word. Because it's so much little legalese, you know, we thought that that would be better in the terms and conditions, and then tell people, yeah, just go under there, and here's the form, fill that out, and then you can upload that.
Okay, so
into the Canvas course.
Yeah, into the Canvas.
Is everybody finding the Canvas okay, do you think?
I did.
Okay,
and
good.
It was pretty clear, yeah. It wasn't uploaded immediately on Wednesday, I think. I checked once, but then at some point it was. I uploaded my vaccine card, and I'm waiting for the money.
Oh, well done, well done.
Yeah. How many students have taken advantage of that program yet?
You know, I don't know exactly, but I think if I had to estimate now, I'm going to say students we're probably about 1,500 or more. I know from a couple of days ago we were at 1,200, but I'm not sure today.
Yeah, I also saw that you had a press release, I think, about that or something similar. So the mask mandate, that would be another precaution. I mean, vaccines work, and we know that, but masks can also work under certain circumstances. If you don't use the mask all the time, like if those masks we usually use, and then you wear that every day, they kind of lose in terms of efficiency. But a mask mandate, it was from the governor, I think, from Oklahoma, mandated that you can't do it. Would you do it if you could?
Well, I don't know about that. Personally, is one thing, and being the president of a public institution is another thing. I won't ever have to consider that as long as we have executive order and legislation that say we cannot deny someone entrance into a public building if they are or aren't wearing the mask, and we can't legally mandate. But we can encourage masks. And like you said, masks help somewhat the transmission. And so I washed all my old masks. I'm hoping to get pretty ones for different colors. I'm trying to wear mine. I'm not perfect at it, and I don't want to ever be the mask police for other people, but we want everyone to know that if you wear a mask at SWOSU, we are mask friendly, and we appreciate it, and we know that you may be trying to protect yourself or others, or even a loved one at home that you're so desperate not to bring it home to.
Absolutely. And the other thing would be some universities in the United States have done it, a vaccine mandate. University of Michigan, for example, even for those studying remotely. Was it ever an option?
It has never been an option legally for us. I cannot see that happening in our future. Would never say never, but that is not in discussion at all. Okay.
And then there are other precautions that can be taken, in terms of testing, for example. I think one thing SWOSU has done in the last semester, or at least in the fall 2020, was they were testing wastewater in terms of trying to figure out how much COVID RNA or whatever is in there. Are you still doing that?
We talked about that in the safety committee. And the discussion was that last year they did it, but it took a long time to get the results back, and then it was kind of hard to pinpoint. It didn't really help us. It might help on a very broad scale, like if you were in New York City or something and you needed to target a particular area comparing to all the other sewage, because in one block they might have as many people that live in Weatherford. But we did not find it effective last pandemic, and there's a lot of differences between the original surge and what we're facing now, and we've learned some things also.
Yeah. Oh, definitely. After 1.5 years, we are much more smarter about the COVID and everything. Let's talk about a contingency plan. We had a somewhat dramatic rise in COVID cases, much more than last semester actually, where it kind of stayed at 20-25 cases for the first few weeks, and then it went up very dramatically, and now we have 43 cases all of a sudden in the second week. So, of course, as a president, you have to ask yourself, what happens if we go over the 100? What happens if we go over the 200? Is there a contingency plan in this SWOSU administration?
Of course. The contingency plan doesn't have an exact number of infections that would cause us to take some action, because this time the pandemic is different. We estimate 30 to 40% of our SWOSU community is vaccinated. And if you're vaccinated, we don't worry about you as much, because the odds of you being hospitalized are remote, and the odds of you dying are minuscule if you're vaccinated. We worry about all of the hospitals in Oklahoma overflowing, and that is almost entirely for COVID cases. For the unvaccinated. And so we can have a rise in our cases that are dramatic, because it is some of those, some percentage, and I'm not sure what percentage, some of those are in the unvaccinated category. They can spread it. If I get it, I can spread it, but I am very unlikely to be hospitalized or die. And then we have a younger population, and they are less likely, but much more likely than the first surge to be hospitalized or die. We were talking with some nurses in Yukon recently, and they are exhausted. And they said they'd had their first underage death. Fought it on a ventilator. He was 15 years old and he died. So I'd urge for us to consider that even the young can get it and die. So we have a safety committee, and we review all of our stats each week. And we can call a meeting at any time if we felt there was a dramatic surge that really needed to take our attention. And we go over things that we can do And we have to think about what can we control. So we can open windows. There's no prohibition against opening a window anywhere at SWOSU.
Maybe during the winter then.
Well, the heat is a little bit, gets to you a little bit. So of course, but that's okay. We'll take a little bit bigger bills if we can do ventilation. But we have done as best as our HVAC systems will do. I mean, we intentionally went and increased the ventilation in all of our buildings. So that's something we've done. We make sure the PPE is out. We've gotten a lot of donations of new PPE and N95 masks. We've distributed those around. We put our plexiglass back up. We said anybody who feels uncomfortable, they should feel free to wear an N95 and lecture behind the plexiglass. Get vaccinated. We have a vaccination clinic on campus today, and of course the big one over in the PCEC tomorrow. So there's lots of things, a big old long list of things we're doing. We encourage social distancing. We try to do as much air quality measures as we possibly can. We have an epidemiologist, pharmacists, nurses, a whole range of experts, but many from our community on that safety committee.
So no concrete, like, it wouldn't be concrete, like 150 cases, now we close campus. That's not gonna happen.
You know, we talked about that because last year I think there was a number, and I don't actually know what the number was because I wasn't president.
Cases.
I wasn't president then, but we didn't have a vaccine then, and we do this time. And this time also, like with the 40-some cases that we have, well, we give those numbers each week. And I happen to know that some of those are coming off of quarantine, and probably today, if we had an official report today, I know I'm going to guess around 10 of those would be out of that number. So, but we're watching it. We also want everyone to know you can get tested at any time, 8 to 5, at the nurse's office, which is right next to the wellness center. You can just say, I'm going home to grandma, I'm scared, I want to make sure I don't have it. We'll test you. Or I've got a symptom, we'll test you.
Wait a second. Testing was never an option at SWOSU. Like last year, there was no option to get tested at SWOSU. So that has changed? You can get tested?
You know, I don't know if it's changed. I've just been president less than 2 weeks, but we have enough tests to test anyone who wants to walk in and get tested.
Okay, so you don't have to go to the Custer County Health Department or anything. You can go to the nurse and ask for a COVID test.
Yes.
For free?
For free.
Okay.
And you can go to you can walk down a couple blocks if you want to on your way down to downtown. Oh, I'm not sure they're going to be open tonight when we walk down at 6. But yes, you can make an appointment for free at the Custer County Health Department Annex, which is here right off campus. Yes, we encourage anyone who wants to know I'm symptomatic, or I just want to know. I want to make sure I'm not transmitting it. Please do.
Okay, so much for COVID.
Okay.
Let's talk about the plans for campus. I think one of the last things Randy Butler did was having a press conference announcing a $5 million donation, which is largely will be contributed to a new healthcare center.
Yes.
What is the latest on that? How much is the planning?
Well, there's a drawing right behind you that shows a rendering of what it might look like. And so we've already set some committees for listening sessions and dates and times. And we're going to hear from the pharmacists, for instance. College of Pharmacy, what do you need in a building? How many labs? How many spaces for diabetes prevention classes? Those kinds of things. Then we will go to Nurses and Allied Health, and we'll have a listening session with them. What do they need to help expand excellent programs for Western Oklahoma, for the state of Oklahoma? We'll go to the community and say, this is what we're thinking about, what do you think? That's how you kind of vet it. Yeah. And we'll probably have a price point of A, B, and C, you know? We'll have the Cadillac version if we can raise this much money. And we'll have, you know, the stick shift econo car down here if we get that much money. So we're very grateful to Jerry Hodge and his wife have given $5 million, our biggest donation ever, single donation ever. and we are applying for some big grants that we hope to get. And then we'll have to raise a lot of money from private donors. So lots going on there. That'll keep me busy.
No, absolutely. And then would you say in terms of like a time frame, how long could it take until construction starts and when it will be completed?
I don't want to set any unrealistic expectations, but this is all something we're looking at. Construction cost, is this the time to build? If we had the money, would we actually start right now? Because construction costs recently have gone sky high, so we need to let that come down a little bit. But I'm going to say, if everything worked perfectly, we would probably break ground in 3 years. So it's a ways off.
Okay.
Okay.
And also one of the reasons probably that you cannot start right away is a financial situation. COVID has put universities under pressure. Relief funds from state or federal government can't really change that entirely. What can you say about the current financial situation? Has it resurrected a little bit? Has it gone up again, or is it still difficult?
Well, we're in good financial situation. We're certainly nowhere near crisis. Our enrollment was up a lot in the summer, which was a surprise. 8, maybe 9% in credit hours, and that's what we get paid on. That's how we get our money, in credit hours. But this fall, it's down a bit. And so we're working on some measures to remedy that. And we're working on increasing our enrollment in Yukon. We have 115 or so students in Yukon right now. And we've only been in a partnership with Yukon for 1 year and 2 weeks. And so we know that that will be a lot of enrollment growth, because that's the fastest growing county in the whole state, Canadian county, and it's in SWOSU's service area.
That sounds pretty good. And once coming back for this healthcare center that we have a great healthcare program here at SWOSU.
Unbelievable.
Pharmacy is one of the best in the country, nursing, whatever healthcare, whatever you guys have. How do you further want to expand that? I mean, you mentioned the partnership in Yukon, and what other plans do you have in mind to make healthcare better at SWOSU?
Well, we are so strong in the hard sciences, which reaches right over into, we have Rad Tech, we have an LPN to BSN program, which is Bachelor of Science in Nursing. We have a BSN to MSN, a Master in Science in Nursing. Those are very popular programs. And then, of course, our great School of Pharmacy. And there is an insatiable demand in this state and in this country for more healthcare providers, like nurses, and of all different types of nurses, from CNA, which helps with the medicines, to LPNs, LVNs, RAD technologists, the full nurses, the masters of nurses. We even have health information management master's degree. So we're in talks with hospitals outside of Custer County for how we can partner with them and build more seats in our nursing program, as an example. And that takes some prep time, some money, some space, and then we can generate more nurses for Oklahoma, which is so desperately needed.
When you came to SWOSU, when you heard about that you got accepted as the SWOSU president, and then you kind of became a little bit familiar with the campus and everything, and now you sit down and say, what is my highest priority for this campus, and where do I see this campus in 5 years?
Well, my highest priority is always COVID, if it is imminently endangering us staying open. But to not get to that gate, we fight it every day. And that's why I want everybody to know, vaccinate. other people around the globe would give anything to have a vaccination. You can get it for free right here. Get your booster shots. Come on, we can do this. And keep your windows open, put your masks on, wash your hands, and don't judge others, because I think the judging of others is hurting the cause. So, safety and security could imminently threaten us. And so I am very concerned about the surges in the hospitals. Please don't, fall down the stairs, don't get on a scooter, and because what if we didn't have a bed for you? I worry about our students in the SWOSU community. But then my priority is enrollment. Enrollment growth, because that is the way for us to all realize our dreams, for us to teach at an economy of scale where our classrooms are full and we are using the tuition money effectively and the taxpayer money effectively and the donor money effectively. So if we can get the enrollment up, we can realize a lot of our dreams.
President Dr. Lovell, thank you so much for taking the time.
Thank you, Johannes. Thank you for coming.